Can you confirm your name and date of birth for me?
Yeah, my name's Edward and 12/27/96.
Okay, nice to meet you, Edward. It looks like I have a prescription here for you. It's for Omeprazole or Prilosec. Um, I'd just like to take a couple of minutes to talk to you about it, some of the benefits that you'll get from it, and some of the side effects to look out for. Do you have time for that?
Yeah.
Okay. To start, what did your doctor tell you about this medication?
Well, he was telling me it should help with my chest pain.
Your chest pain? Okay. Yeah, it can help with some chest pain. This is used to treat symptoms of gastroesophageal reflux disease or GERD. It's also associated with heartburn. So if you have some pain in your chest, it could be used to treat heartburn. This is, like I said, omeprazole or Prilosec. It's a 20 milligram capsule, and you're going to take one by mouth each day, 30 to 60 minutes before you eat breakfast. Before breakfast is the best time of day to take it, but the important thing is just 30 to 60 minutes before food. You'll need to take it with a full glass of cold water. Warm water will dissolve the outside of the capsule, and there's some little granules in there, so we want to use some cool water just to make sure it gets down your stomach and it doesn't get stuck on the way down. You want to keep this at room temperature. It has a couple of issues with moisture in the air. It can make the capsules stick together, and so we don't want that. If you forget to take one in a day, it's okay. Just take it as soon as you remember it. But if it's close to the next morning and you're going to take one anyways, just go ahead and take that one. Don't take more than one in a single 24-hour period or in one day. It may overly reduce the amount of stomach acid that your stomach is making, and so if it goes too low, there is a potential that you could get some really bad diarrhea that's associated with a bacterial infection. It's not too common, but it does happen when people are on this, rarely. So this medication is going to take about 72 hours to really take effect. Um, you'll still probably feel some burning sensation in your chest, especially if you eat really big meals or things that are spicy or are acidic, like if there's tomato sauce, so pizza, spaghetti, those sorts of things. 72 hours is when you'll feel the most benefit, but you'll still feel something after about a day of taking it. It's only one a day. It works all throughout the day. It just takes a little while to build up in your system and to start working. Um, this is going to be taken most likely for the next 4 to 6 weeks. If you start to notice that you're feeling fine and you don't feel burning in your chest or your symptoms are going away, then go ahead and call your doctor. This only needs to be taken until your symptoms are under control. And then if you need something long term, there's other medications that we can use. If you feel like the burning in the chest is really severe and it doesn't seem to be going away with this medication, let your doctor know as well. There's different strengths of this, and we'd rather you talk to them and see if you need to increase that dose before. Uh, um, let's say if you have the really bad burning sensation and you feel like, oh, maybe if I took two, it would really nip it in the butt. Yeah, we wouldn't want you to do that just because of that bacterial infection potential that I told you about. So keep that in mind. It is possible that you could have an allergic reaction to this medication. It's very rare, but it could happen. If it happens, you'll get a rash or hives. You'll feel pretty itchy. Your mouth might swell up and your throat might swell up. So if that happens, stop taking it and let your doctor know immediately. And this also might interact with certain medications like mood stabilizers or antiplatelets or blood thinners and some antibiotics. So if there's any other prescription or over-the-counter medications that you're thinking about taking or currently take, give me a call. I'd be happy to look and see if that's going to be compatible with this one. If not, I'll let you know as well. Your doctor may check your magnesium levels in your blood before you start taking it. He may have done some blood work when you're at the office. Maybe not, but this may decrease the levels of magnesium in your body, and that might make you get some muscle aches or cramps, and it might make you feel a little bit weak in the day. So if that's happening, let your doctor know as well. We can give you a magnesium supplement. It's over the counter. So I know that was a lot of information, but just to make sure that you got some of the main points, can you tell me as much as you remember?
Just one a day. It should help with my chest pain or I guess my heartburn. watch out for signs of allergic reactions. Don't take 2 in a day, only take up 1. Usually take in the morning before 30 minutes before eating. Any others that I'm missing?
You got most of them, and I know there's a lot. So on the bottle, there is some of the main points, and then also I'm going to give you this patient guide that will walk you through some of the main things. If you can't remember, you could always refer to that or give me a call. My phone number's on the bottle. So, you have any questions or concerns about the medication?
I don't think so.
Okay, good. Well, don't hesitate to call me if anything comes up,
Okay.
and have a nice day.